Welcome everybody to the Wednesday lesson of the day. The story with this is, it's a Wednesday lesson that we began after my consult days a while back. On Wednesdays in the middle of the week, I see about 50 patients, and there's always a common theme that I see amongst the patients. People doing the wrong thing, the right thing, crazy things going wrong, new procedures, and the classic old bad procedures. So I love to bring those up, whatever was the predominant theme that day, and introduce it to my Instagram audience. Now I want to do it here for our YouTube family. A little dizzying with all the different things that I saw, but the most interesting that I haven't gone over is something called thyroid eye disease. Thyroid eye disease, they call it a disease. It's not like that horrendous type of disease, but it is a thyroid eye immune issue, which means that your body over time starts to attack yourself and your tissues, and you get thyroid eyes. Thyroid eyes are the eyes that change the character of your face pretty substantially over time by pushing the eyes outwards from pressure inside the eye socket, because the eye socket is a fixed bony compartment. And when you add tissue in there, it starts to push the eye outwards. And with it, the fat starts to come out more. It grows more. The muscles start to function differently. You also get your lacrimal gland, which is a tear gland, pushing out more. So what happens is people's eyes become largely asymmetric. They bulge out more. They start to look like they have a lot of shadows around them. So they look bright on top, dark on bottom is how it looks. And they look remarkably tired and aged from this. You also notice that thyroid eye disease has effects on other part of the face. So people that don't gain weight, their face starts to gain weight. And the reason for that is they get fatty deposits in their parotid gland and their submandibular glands and in the deep pockets in the neck as well. So it has effects all over. The specific effects on the eye, again, the upper eyelid fat pads, which you have the nasal fat pad, which comes from inside, and you have this central fat pad, which we call the preaponeurotic fat pad. Those tend to bulge out. There's also a lacrimal gland, which is your tear gland that sits up in the bony fossa over here, and that starts to come out over time and droop. So all these things are hooding over your eye. Your eye itself starts to get ptosis, usually on one side more than the other, meaning it looks sleepier on one side than the other. And the lower eyelid bags start to come out pretty big time, causing a big shadow underneath here. So that's what you see around the eyes. If it gets severe, you get what we call diplopia, which is you become cross-eyed or have blurry vision because of the problems with muscle function. The procedures that we performed for this classically were types of decompression or fat reduction, where you can do cosmetic types of blepharoplasty, upper and lower, and reduce the fat or transpose the fat, and you can tuck the tear gland back in, but eventually the problems recur. So there are other more severe types of decompression, which involve drilling out the bone, usually on this lateral part of the orbit on the inside. You can drill it to create more space, or you can go from the eye and create more space this way into the sinuses. If you look at everyone's eyes, they have these two little dots, one here and one there. They're called the punctae, and they drain into the nose. So that's where your tears drain, is inside the nose. And you can actually go endoscopically inside the nose and do a decompression that way. But those decompression surgeries cause a lot of problems with double vision. So you don't do it really unless you have to. So most oculoplastic surgeons that do this surgery are very cautious about it. And most would do one eye at a time, not necessarily both at the same time. The coolest magical thing now that's been developed by Raymond Douglas is called Tepezza, Tepezza, also known as tomapetapudumab. It's like a monoclonal antibody type name. It's a medicine that can, in many people, actually cure the thyroid eye disease or improve it dramatically from taking a medication. Now, the medication can have different side effects, of course, but it's pretty magical from what I've heard. And I haven't researched it fully yet, but from patients who have had it, it's changed their lives without doing surgery. I think it's going to have the same effect on the parotid glands and the submandibular glands, meaning it might reduce the mass of the entire face. I do facelifting on people with thyroid eye disease, and you do have to treat them a little bit differently. So I tend to reduce the submandibular glands on them. I do a posterior tail of parotidectomy to reduce that, and then afterwards I put a ton of Botox into the glands to shrink them, because it's hard to go after them and get rid of all of the gland without damaging nerves, and it's really not worth it for cosmetic purposes. I don't think I'm not good enough to take out the whole gland gland without causing a problem. So I just reduce this gland, and then I inject them with Botox to shrink them. When you cut into the glands, you do notice that they are fattier. So people with thyroid eye disease have a different salivary gland tissue than people without. So it's the yellowish kind of color rather than white. So that is thyroid eye disease. And if you notice that people's character of their eye is changing over time, or your own is changing over time and becoming more prominent as the eye starts to bulge, most likely that's what's happening. And it doesn't mean you're going to find anything necessarily on blood work. You might find normal thyroid hormone levels and your thyroid might look totally normal. All it means is that there are antibodies within your body that attack your cells that are related to the thyroid somehow. So that's why we call it thyroid eye disease. But it does not mean that there's anything actually wrong with your thyroid, although in many cases there are, if you have something called Graves' disease. And that's the most common form of thyroid eye disease that we know about. So that's it. The most boring one I've done yet, but it's a very interesting topic. I hope you all can learn from that.
Thank you all for watching and being part of our community. Please drop any questions you have or anything that you want us to review that you've been wondering about or are confused about in the world of cosmetic or plastic surgery.